stretches and routines to overcome lower back pain. Painful symptoms. Mishaps and non-prevention can do a number on our lower backs. Shoveling snow or other life events can leave a person with symptoms ranging from a sharp stabbing sensation shooting across the back or down the legs, a dull ache that causes you to notice how gingerly you are moving, or difficulty in getting up and down. When to see a professional. If you are still in pain beyond 72 hours after the initial injury, medical advice should be sought. Furthermore, if you sustained your lower back pain from a fall or lifting something in an improper manner and numbness sets in, bladder or bowel problems arise, you have a fever, or feel pain when you cough, seek immediate medical advice. We want to prevent anything from becoming permanent or morphing into something more serious. Do not wait. Contact your primary caregiver or go to a hospital. Stretches. There are many stretches we can do to both help our lower back pain, but also, if practiced regularly, possibly prevent a lower back injury. Now I do want to warn anyone doing these stretches, do not worry about passing gas. Trust me, as I know the occasional flatulence is very freeing and can help the back out. The first stretch is the prayer stretch, which is quite easy and effective. Here we kneel on the floor, tuck our legs underneath our stomach with heels bent forward to support the gluteus maximus, and extend our arms out over the head forward onto the floor. Holding that position while breathing in deep breaths for 30 to 60 seconds 3 to 5 times in a sitting can help the ligaments and muscles in the back strengthen. The next stretch is to lay flat on your back, grabbing one knee at a time while pulling it towards your chest with both hands. Switching knees, you will want to hold this position for 30 to 60 seconds 3-5x while you make sure to breathe. A remarkably similar stretch is obtained by grabbing both knees at once while pulling them up to your chest and then rocking gently and slowly forward and back. These stretches allow both the muscles and ligaments in your back to stretch naturally and strengthen the area. The piriformis stretch helps the glute muscles, which can cause lower back pain. Laying on the ground with one knee bent, we cross the ankle of the opposite leg to be stretched over the bent knee. We pull the crossed knee towards the chest. As with all stretching, we want to take deep slow breaths for 30 to 60 seconds for 3 to 5 times in a set. Stretching the gluteus muscle in strength and in length can prevent or help stabilize an irritated sciatic nerve. This stretch is perfect for those of us who sit at a desk, drive for long periods, or climb stairs for a good part of our day. The spine twist finds us laying flat on the ground, extending our arms into a T shape. Keeping our shoulders on the ground, we bend one knee over our leg while pointing our head in the opposite direction. This is another exercise perfect for the sciatic nerve and the glute muscles. Finally, we cannot think just about the back itself. We must look at the front where core stability is. This would be our abdomens. The reverse crunch mimics the classic crunch, in which we lay on our backs with our hands flat on the floor and raise the feet off the floor while pulling the knees forward using your abdomen. A good strong core can help a sore lower back and prevent one from ever happening. Each one of these stretches is important in helping our lower backs regain the strength they need to do routine and daily jobs in a proper manner. They do not require much time, but their effectiveness has been proven and shows excellent results. Whether your lower back is injured or not, stretching will help your situation rather than hurt it. Routines and prevention. There are things in our daily routines that we might not be aware of that affect our lower back, as well as healthy habits we can get into to prevent lower back issues. This includes creating a healthy environment and paying attention to ergonomics, doing daily stretches, staying active, maintaining foot care, and regulating weight issues. Finding a comfortable sleeping position also helps, and remember, a good mattress is not just a purchase, it is an investment in your health. Doing daily stretches helps keep a healthy posture and system for maintaining a healthy lower back. They not only assist when you are in pain, but they also prepare you for the various back positions that we all encounter. The stretching recommendations listed earlier are proven to work. Yoga is an exceptionally good way to get into the routine of doing such stretches each day. If you think stretching may not work for you, look at the great Tom Brady, the quarterback for the Tampa Bay Buccaneers. He is over 40 years old and plays an extremely physical and brutal sport. He takes time to stretch his muscles, especially his lower back, which permits him to not only stay competitive but excel at a high level. Stretching is particularly important. Staying active in your life does not mean you have to be in a gym all the time. Go slowly. Try to keep up with what you can. A simple walk around the block, taking the stairs at work, devoting 15 minutes each day to do curl lifting with soup cans may go a long way toward preventing future health problems. These easy-to-do activities get the blood moving throughout the body and stimulate muscles and ligaments, bringing further strength to them. You can never be over-prepared for future events, as well as healing past ones. We do not think of it often, but we are on our feet constantly. It is good to know and understand how our choice of footwear affects our posture and back health. Your shoe selection can be a huge cause of lower back pain, among other things. You may also want to investigate Dr. Scholl pads or other inserts that specifically adjust your foot to give you better posture, which in turn benefits the back. Let's talk about weight. Simply ask any woman that is or has been pregnant, or had extra weight around their core area, and how it affected their back. Those extra pounds will pull down and put a strain on those ligaments and muscles in your lower back. We all are different shapes and sizes. Eating right, paying attention to your nutrition and exercise will help you achieve a stronger lower back. Something that we might not think of but can play a crucial role in preventing lower back pain is the type of clothing you wear. Tight clothing that constrains our bodies does not allow adequate blood flow to the area. Carrying backpacks, purses, and briefcases will cause strain on your lower back. Also, be aware of how you are carrying such items. Do you sling them over the same shoulder, or use the same hand in carrying? Be cognizant of your usage of such items. When you wear or use them in a manner fitting of your comfort, distributing the weight equally, the less likely it will affect your lower back. Heat versus cold treatments. Both heat and ice can be useful in bringing some relief to your lower back pain. However, when do you use which for it to be effective? It is stated that using cold packs within the first 24 to 72 hours of when you injured your lower back helps minimize inflammation and swelling. It is recommended that cold therapy be applied for no more than 20 minutes for a maximum of up to 10 times in a 24-hour period. Once the initial inflammation period is over, it is then advised to apply a heating pad or heated compresses. The heat stimulates the blood in the system to help with stiffness in the area. If your lower back pain is a chronic condition, seek the advice of your doctor concerning the further applications of heat and cold treatments. Medications and supplements. Depending on the severity of an injured lower back, there are a range of medications that may be used to help. Over-the-counter medications such as Tylenol, aspirin, or Aleve can be effective, in addition to stretching and heat and cold treatments to help ease the pain. Upon seeing a doctor, they may prescribe such things as muscle relaxants or an opioid medication to stop the pain. As with taking any medication, caution should be used in what is taken and how much. In some instances, medications may mask deeper issues that must be accounted for. Your pain may go away, but the problem could remain. Always be sure to consult your physician. Collagen and boswellia are also natural supplements worth looking into. Studies have shown that boswellia extract acts as an effective anti-inflammatory, and collagen helps to keep our bones and joints healthy as we age, including our spine. These natural remedies will help ease lower back pain and are particularly good long-term solutions for maintaining a healthy back as you age. Incorporating them into your daily nutrition can offer relief from injury or inflammation. Summary points. If you are still in pain beyond 72 hours after an initial injury, medical advice should be sought. There are many stretches we can do to help our lower back pain, but also, if practiced regularly, possibly prevent a lower back injury. Dr. Scholl pads or other inserts that specifically adjust your foot to give you better posture, can in turn benefit the back. Using cold packs within the first 24 to 72 hours of when you injured your lower back helps minimize inflammation and swelling. Studies have shown that Boswellia extract acts as an effective anti-inflammatory, and collagen helps to keep our bones and joints healthy as we age, including our spine.
Thanks for watching. Subscribe for more wellness inspiration.